Studies indicate a rise in the diagnosis of mental health disorders, such as anxiety, depression, and ADHD. This is partly due to greater awareness and reduced stigma. According to the World Health Organization, mental health disorders are among the leading causes of disability worldwide. Over the past 3 decades, there has been an increase in available mental health services, including teletherapy and community support programs. Many regions have seen improvements in insurance coverage for mental health services, driven by legislation such as the Mental Health Parity and Addiction Equity Act in the United States. But there has been a significant cultural shift toward understanding and accepting mental health issues, aided by advocacy and public awareness campaigns. Increased representation in media and pop culture has contributed to normalizing discussions about mental health. The rise of apps and online platforms for mental health support has made resources more accessible, especially among younger populations. The COVID-19 pandemic accelerated the adoption of telehealth, allowing more people to seek help without the barriers of location or stigma. Social media, well, it's a bit of a double-edged sword. On one hand, it has provided platforms for support and awareness, which is great. But on the other hand, it has also contributed to issues like cyberbullying and comparison, and these can really affect mental health negatively, especially among adolescents. Research has shown that heavy social media use is linked to rising rates of anxiety and depression in youth. It's a complex issue, for sure. Economic factors play a significant role in mental health. Financial stress, particularly during economic downturns like the 2008 financial crisis and the COVID-19 pandemic, has led to increased anxiety and stress, impacting many people's mental well-being. Job insecurity is another major factor. The rise of the gig economy and shifts in job security have contributed to feelings of instability and mental distress. Youth mental health is an area of growing concern. There has been a noticeable increase in mental health issues among children and adolescents, with reports indicating higher rates of anxiety, depression, and suicidal ideation. While many schools have started to implement mental health programs, access to these resources still varies widely. In our overall assessment, it's clear that while awareness and access to mental health services have improved, certain populations, such as youth and marginalized communities, have seen worsening mental health outcomes. The COVID-19 pandemic has exacerbated these issues globally, leading to increased rates of anxiety, depression, and substance use. In summary, while there have been significant improvements in awareness, access to services, and stigma reduction regarding mental health over the last 30 years, challenges remain. The overall landscape is complex. Certain populations face worsening mental health conditions, particularly following the pandemic. This highlights the need for ongoing efforts to enhance mental health resources, ensure equitable access to care, and address the specific needs of vulnerable groups. Moving forward, it's crucial to continue these efforts to create a more supportive environment for everyone.